I'm Dr. Stuart Menakar from the Palo Alto Medical Foundation Los Gatos Center. Welcome to Health Connections on KCAT Television, Los Gatos, Monte Sereno. Today my guest is Dr. Susie Butler from the Palo Alto Medical Foundation Department of Dermatology. Thanks for joining me.
Sure, thanks for having me.
So, Susie, I've known lots of doctors, and I always wonder about how do people decide on their specialty. So I've known a urologist named Dr. Waters. I've known an orthopedic surgeon named Dr. Bonebreak. And I wonder, in your case, Susie, did you become a dermatologist because you have naturally beautiful skin?
Oh.
Or have you had to work at that?
Oh, well, thank you very much. No, I think, it was during my medical school, we had to do different rotations in different areas. And when I did my dermatology rotation, I just loved it. I was really struck by just how much people's skin disease actually affected their lives. Anything from just a teenager with really severe acne to someone with really intense itching to blistering skin diseases that are painful. People have to deal with that day to day, and it really affects their lives. So luckily in dermatology, I feel like we have a lot of really great treatments that we can really help people with those things. So I also was struck by the variety in dermatology. I see kids with acne and warts. I see my cosmetic patients with wrinkles and sunspots. And then I see more complex medical dermatology patients. And then my focus is in skin cancer surgery and reconstruction. So I get a little bit of everything, which is nice.
That sounds interesting.
Yeah.
One thing I think a lot of our patients don't understand about dermatology, and I hear this some about other specialties like ophthalmology, is that different parts of our body can reflect troubles elsewhere. Mm-hmm. So while it's true that very many skin problems, skin disorders, can be a symptom of a deeper problem like cancer or an autoimmune disorder, mm-hmm. we're probably not going to get to too many of those in our conversation today. We're going to talk mostly about the most common things. But I would like to be sure that all of our viewers understand that dermatologists are very highly trained medical doctors who help us in primary care, like me in my family practice. That dermatologists help us with the care of all kinds of disorders, not just wrinkles and pimples and skin cancer.
That is true, yep. We do look for those things, so if we do see a interesting or unique rash that could indicate something more serious is going on inside, we always pay attention to those things. But most commonly, we're dealing with things that are on the surface of the skin, acne and rashes and medication reactions and those kinds of things.
Well, Susie, let's start with the very basics.
Okay.
Help our viewers understand, if you would please, just the basics of skincare. How can I make sure that I have beautiful skin as I age?
Well, I think really simple is better most times. So I think just washing your face twice a day with a really gentle cleanser. You don't want to irritate your skin with harsh scrubs or really fragrant soaps and those kinds of things. One really important thing is to wear a sunscreen every morning and to choose one that is broad spectrum, so it blocks the UVB and UVA rays. I tell my patients all the time to just wear it every day, rain or shine. If it's cloudy out, those UVA rays can still come through and cause problems later. So just a daily morning sunscreen. And I think to find one that you don't mind putting on is really important. So some of them can be smelly or sticky, but if you can really find one that's even just built into a moisturizer, I think it's not so bad, and just kind of wear it on your face every day on all the exposed areas, really. And then I think just finding a good moisturizer to put on at nighttime. There are lots of choices out there, I know, but I think things that are also fragrance-free is important, because I see a lot of people reacting to the more fragrant ones and that kind of thing. So I think it's as simple as that.
Well, Susie, as you and our audience can see, we're sitting here in the beautiful sunshine today at the Palo Alto Medical Foundation Los Gatos Center. Both of us, I assume, are wearing our daily sunscreen with a moisturizer. And other than that, and as you mentioned, gentle cleansing and a nighttime moisturizer, other things particularly that adults should be doing regularly to help, or things they should avoid doing, to help maintain healthy skin throughout a lifetime?
Yes, well, actually, I'm glad you brought that up. I think one thing to really avoid is smoking. So that can be really harmful to your skin, and you can really look at someone's skin and know if they're a smoker, both with just the sallow yellow color or wrinkles around the mouth. Smoking can be really harmful to your skin. Other things, just keeping yourself well hydrated, drinking a lot of water, eating a healthy diet, lots of antioxidants, all those things I think are good for adult skin too.
Okay, Susie, so we've been talking about prevention of skin troubles. I'd like to ask, what do you think of tanning booths?
Yes, I'm glad you brought that up. Actually, tanning booths are a very important source of really dangerous UV exposure, especially to our teenage population and young adults. There's actually been a movement to sort of ban teen access to tanning booths. So now in a lot of states, it's required that the parental consent is there for teens to be able to tan there. Now studies have actually shown that tanning booth exposure has contributed to both melanoma and non-melanoma skin cancer.
Pretty dangerous stuff.
Yeah.
Well, how about for our patients who want that nice tan look, who we don't want them out at the beach in the sun, and we don't want them in the tanning booth? What do you think of spray tans?
Yes, I actually would definitely recommend sunless tanning products. You can apply them as lotions. You can find them easily in the pharmacy, or you can actually go somewhere and get a spray tan. And that is a very safe way to get some color, and it does not increase your risk for skin cancer. Occasionally you can get a little bit of irritation from the products, but most people tolerate them just fine. So
It's a good option.
Yep.
We've talked about how many different products there may be for helping with our skin. Let me ask, if you would please, to start with what we as parents should know about skincare for our little ones, and then if there are things that we should know in terms of changing skincare up to, say, teens and young adults.
Yes, so starting with just infants, sun protection is still really important in this age group, but up to 6 months we don't actually recommend putting sunscreen on the infant's skin, but they really need protection because they don't yet have that melanin to naturally protect their skin. So really clothing is what we use, so just protecting with long sleeves and hats, maybe using a hood or a little canopy over a carrier or a stroller is great for that age. And then after 6 months you can certainly apply sunscreen, especially when they're outside. I would choose sunscreens with physical blockers like zinc and titanium are 2 ingredients to look for. We recommend those as opposed to the chemical blockers that can sometimes be in other sunscreens. And you can find that easily. Usually sunscreens will say baby on the label, so I would do that daily. And also in this age group, they do have somewhat sensitive skin, and some of the baby shampoos and cleansers actually do have a lot of fragrance in them, so I would just try to find one that is fragrance-free, especially with kids, for kids with sensitive skin. And then as they get older, and especially if they're spending more time outside playing sports or at recess at school, it's really important to cover up with hats, sunglasses, and sunscreen all the time, because I think we get about 80% of our sun exposure before age 18. So especially with our kids and teens, it's really important, the sun protection.
Is there special clothing for sun protection that's good for our very active teens and others, adults who are active?
Yes, there is. You can look online or in sporting stores and find clothing with a certain UPF. That's sort of the indicator of how well that cloth is going to block the UV rays from your skin. But truly, I mean, any cloth I think is helpful to just wear long sleeves and hats and sunglasses. Also, they actually have, I think, detergents that you can wash into your clothes that will make them have a higher UPF. So any of those things I think would be helpful.
And Susie, I would also like to just add, as I tell my patients in my own family practice, that applying that sunscreen is a daily activity. It's not just on sunny days. It's not just when we're out in the sun a lot. That even on a cloudy day or potentially even a rainy day, a large percentage of the damaging UV light comes through the clouds, and we can cause skin damage even when it's not sunny.
Definitely, that's definitely true. And we have also new options for sunscreens now. Sticks are kind of good for kids sometimes that don't like the smearing the lotion on their face. Lip balms with sunscreen is actually very important too, to protect your lips. So I think that would actually, thinking about all those things is really helpful.
Well, as we talk about kids and we get on to teens, most teens aren't too worried about skin cancer or skin care except acne. So let's move on a little bit and talk some about acne. Would you please explain, why do we get acne?
Yes, good question. So it usually happens when people get into their teenage years, and the change in hormones can sometimes cause our skin to produce more oil. And the oil causes our skin cells to kind of clump together and get stuck down into our pores or follicles. And that creates a little blocked pore. And then when bacteria moves in there, it can cause some of the symptoms that we see, like the redness and the swelling and the tenderness, and that creates a pimple. So it's sort of all of those things working together.
What's the cure for acne?
Well, it's hard to find a cure, but we have lots of treatments that can help and manage it and really get your skin clear, but it does take some patience. So I would say if you have mild acne, probably starting with some of the over-the-counter things I think are helpful. Usually the ingredients you can find over-the-counter are benzoyl peroxide or salicylic acid. Those are usually found in medicated washes or gels. I would recommend also applying the medication to your entire face rather than just waiting until you get a pimple and then trying to spot treat it, because then you're not preventing them from coming up. So those are sort of the beginning things you can do. If your acne is not responding to that, then you can see probably your primary doctor first, and they can prescribe some things. We have sort of different categories of prescription creams that we can use. One category is the retinoids, and that type of cream actually helps unclog your pores. Sometimes they can be a little bit drying and cause a little bit of redness at the beginning, but then your skin usually gets used to it after a couple of weeks, and that's also when the acne starts to clear after a few weeks. There's also antibacterial gels and creams that you can use. And then if your skin's still not responding to that, sometimes we'll add an oral antibiotic.
And are there times when folks with acne should definitely see a dermatologist?
I think if they're not responding to sort of a first-line regimen like that, there are different types of acne. You know, some of the just clogged pores might respond to the retinoids better. More of the inflammatory pustules and that kind of thing might respond to antibiotics better. So if you're not responding to that, or if you're starting to get scarring, then I think we can certainly help with that. And there are other things that we can do for more severe acne, like Accutane and those kinds of things when it gets pretty bad.
So a whole range of treatments, starting with things you can do at home with just facial washes to keep your face clean, topical treatments that will help remove loose and dead skin cells, then potentially prescriptions that will help with skin cells, unclog pores, antibiotics for the pimples, and then if things are problematic, even treatments that will reduce the production of oil and not really cure, but
yeah, I mean, certainly Accutane, I think, does give a lasting effect. Other things to bring up, you know, I see a lot of teenagers with acne, but more recently I've been seeing sort of young adults in their 20s and 30s, especially women that are getting adult acne, and it's really frustrating for them because they think they've put that behind them in their teenage years, but now they're all of a sudden starting to break out. And I think that is more caused usually by changes in hormones, so we approach that acne a little bit differently, and oftentimes we'll give sort of either hormone therapies or like in birth control pills or other kinds of treatments that can block testosterone and that kind of thing. So there's other treatments that are more newly accepted, I think, that are helping with adult acne.
So, a funny story, when I was a teenager in high school, I'll never forget my senior English teacher, very bright, great teacher, came in one day complaining about acne and how she was tired of having acne. And I don't know how old she was, but she was very upset because her doctor told her there were only 2 cures for acne: menopause and death.
Oh my gosh. I promise we have many more treatments than that, yes.
I think everyone in the audience will be happy to hear that.
Okay, good.
Susie, let me ask about food and skin health. There are lots of things I hear from my patients, and many of them I don't know exactly what to tell them.
Yeah, I get that question a lot. And it's sort of been a little bit controversial. There has been a recent study actually tying diet to acne. We have found that foods with sort of a high glycemic index, like carbs and sugars and those kinds of foods, can increase inflammatory acne. So I would say if you can avoid those foods, I think that's only helpful. Other things people have tried, like dairy restriction and gluten restriction, that has not yet been proven. So I would say just trying to eat a healthy diet, I think, is helpful, and just trying to avoid those high sugar foods.
But what's more important, diet or washing your face, not squeezing pimples? What's the best?
I think all of those things are more important. I think certainly washing your face twice a day, not picking at your skin and not touching your skin all the time. Also not, sitting with your hand on your chin or kind of things that cause friction on the skin. Those can all contribute to pimples too, probably a lot more than diet can.
There are a lot of, worrisome or things that make our patients unhappy about their skin that aren't terribly dangerous but are very treatable and will help quite a bit with comfort. So I'd like next to talk a little bit about what does the skin look like and what kinds of troubles do we see in terms of common rashes that our primary care doctors and our dermatologists treat. We have a nice little diagram here from your office about skin.
Okay.
And if you could you maybe point out some of the features here for our audience about our skin?
Yes. Okay, so just to kind of give you some background, this is a sort of microscopic view of the skin, and it nicely shows, I think, the different layers of the skin. So the very top layer here is the epidermis, the very most superficial layer of the skin. And then just deep to that, we have the dermis, which is more of the thicker layer of the skin that has collagen, and also some other structures. As you can see, there's sort of blood vessels running through there, there are nerves, there are sweat glands coming to the surface, and then this is our hair follicle here, which is sort of pertaining to our acne discussion that we were just having. This is actually what gets blocked in acne. Here's our oil gland, and that's what's pumping out the oil and creating more acne as well. And then the deepest layer over here is just the fat. So That's underneath the skin.
So many of these pictures are probably a little bit too small for the folks watching on television to understand well. Perhaps we could start at the top, and you could tell us about some of the disorders, perhaps of different layers, and how we might approach them.
Well, I guess the acne that we talked about is definitely relevant here. So again, the pore is sort of what's involved in the acne, with the oil production causing those skin cells that come off this very top layer called the stratum corneum. They get clogged together and then they get jammed down into the pore. And actually this is an example of, believe it or not, a little acne pimple. So it's sort of a little plug here with skin cells, and it causes some inflammation once the bacteria gets in there.
Susie, I was just going to ask, where do we see things showing up like cysts? A lot of people get cysts in their skin that you might remove for them. Where does that happen?
So right underneath the top layer. So it basically starts usually in a pore, and the pore turns in on itself and actually starts shedding these cells that normally go to the outside into a little sac. And that sac fills up, and if it gets big enough, then it actually comes down deeper into the fat layer here. But it actually starts with the pore here. And so you get this little ball of skin cells underneath the skin. And usually they're benign growth, they don't cause many problems, but sometimes they can get inflamed if bacteria tracks down here too.
And while we're talking about lumps like cysts, there are these lumps called lipomas, fat lumps. Where do we see those?
Right, so those are, sometimes we call them fatty tumors or fatty growths, and they're actually in the fatty layer, and they're an encapsulated ball of fat basically, so right down here underneath the skin and the fat.
Everyone's heard about the heartbreak of seborrhea and psoriasis. How about if we talk about those? Those are in the superficial layers.
Let's talk about maybe seborrheic dermatitis first, or seborrhea as it's often called. So that happens very commonly when our skin actually responds to a yeast that lives on everybody's skin, but in certain situations it overgrows or our skin becomes more responsive to it, and we get these little pink flaky patches. This is actually what we see as dandruff on the scalp, and then some people can actually get this sort of around the nose or in the eyebrows on the face, and then it also causes cradle cap in infants. So it's the same process. If you have this, you can sort of start by just using some over-the-counter shampoos that treat dandruff, and you can actually even use that on the face if you would like to treat the if it's affecting your face. If that doesn't work, then sometimes either your primary doctor or dermatologist can prescribe a prescription shampoo that has sort of an anti-yeast medication that can help.
And how about psoriasis? I know sometimes patients come to me thinking that it's just seborrhea or something of that sort, and we say, no, it's a little bit more serious, it's psoriasis.
Right, and there are a lot of different presentations of psoriasis. So you might just have flaking on the scalp. Typically it's in more sort of discrete patches or like thicker plaques on the scalp where you have this thick whitish scale, but it can affect other areas as well, commonly the elbows or the knees, sometimes around the belly button. Sometimes it can affect the nails actually, and you get certain nail changes in psoriasis. And actually sometimes in a small percentage of people it can actually affect the joints and cause what's called psoriatic arthritis. And in those cases we definitely want to recognize it and treat it because it can actually cause destruction of the joints.
So a good example of how the skin is a reflection of other underlying disease sometimes. So we treat psoriasis many times, at least in primary care, with topical treatments. Anything in particular you want to tell us about those?
Yeah, so I think, if you have psoriasis, you can start out by using topical steroid creams, and it's important to talk to your doctor, I think, about the safe way to use those, usually a few weeks at a time, and that can actually calm down the inflammation in the plaques and cause them to regress over usually several weeks. Psoriasis is sort of a chronic condition, so you will sort of be dealing with it over the long haul, but you can make it much better with these treatments. So if it's localized or if it's covering just a small area, I think that these creams can be really helpful. Sometimes it's just not practical to apply these creams everywhere you have psoriasis. Some people can get it over a large portion of their body. So in those cases we can do phototherapy, which is kind of a unique thing that we do. In a lot of our dermatology offices, we actually shine UV rays on the psoriasis patches, and that causes the inflammation to decrease and your psoriasis to get better over a period of a couple months.
So that's why a lot of people have less psoriasis trouble in the summer.
Exactly, yes. I've had patients say, I went to Hawaii and my psoriasis cleared up, so.
Lucky them.
I know, so yeah.
Well, just a couple things I'd like to mention about psoriasis. Again, as you mentioned, it can be a reflection of underlying disease, and in family medicine, one thing I see a lot that teaches me that someone has psoriasis is they come in with strep throat and they're covered with psoriasis spots.
Exactly. Yes, that's an interesting presentation. It's called guttate psoriasis, and it's when the strep bacteria actually triggers our immune system to really flare with this full body rash of psoriasis where you get these small little patches pretty much head to toe. That's fairly treatable, and usually that sort of responds to treatments even better than this more typical psoriasis, but it happens in young, healthy people all the time.
Another thing commonly we see is people say, I scratched myself and the rash spread right into where I scratched.
Yeah, that's neat. It's called the Kebnerizing phenomenon, but basically the psoriasis will come up in areas of scar or trauma to the skin. So even old scars, the psoriasis will come along in old scars sometimes, or certainly if you scratch yourself and there's trauma to the skin, the psoriasis will actually form along that line. It's kind of neat.
Neat for us, not so great for our patients.
Yeah, I know.
Well, while we're talking about scratching, hopefully most people with things like poison ivy and those sorts of troubles never get it so severely they need to see you in your practice, but I see it a lot. And a lot of people still ask me, can I spread my poison ivy or my poison oak by scratching the sores?
Yeah, it's a good question. I have a lot of patients asking that. So I guess the short answer is poison ivy is not contagious. So when you have the rash, you cannot spread the rash to other people by touching them or through the air or anything like that. The only thing that can happen is that if that sap from the plant is still on your skin or perhaps on clothes that you were wearing when you encountered the plant, then that sap can cause new patches of poison ivy. So that can happen sometimes if you're wearing, gardening gloves that you haven't washed, and say you put them on again and you can get new patches.
Okay, well, I'm glad, Susie, that you mentioned gardening, because as everyone viewing us today can see, we're filming in early February, which is early spring or late winter, and a lot of us are getting out in the garden. And poison ivy, well, here in California, most people call it poison oak, but back east, where I grew up, it's mostly called poison ivy, but it's the same plant and the same reaction. But I see folks starting to come in this time of year because they're clearing out all the old twigs and sticks and garden rubbish from the previous fall. And you can get the oils from the plants just from bare twigs. Another thing we sometimes see is we go out for a walk and take the dog, let the dog run off in the weeds and come back, and wouldn't you know it, they of course run right through the poison ivy or the poison oak and don't get any rash, but they get plenty of oil on their fur. And we say, oh, good boy, good boy. And now we've got it all over our hands, we scratch our face and spread it. So keep that in mind when you're in the garden and out hiking this time of year. So Susie, I really appreciate you being with me here on the show today.
Thanks for having me. It was fun.
It's my pleasure. It's great to learn about skin. Any last pearls of wisdom about skincare you'd like to share with our viewers?
I think the most important thing is just using a daily sunscreen every single day. That prevents skin cancer, it keeps your skin looking healthy, it prevents wrinkles in the future, so that's probably the biggest tip that I can give. And then just keeping your skin regimen simple and following a healthy lifestyle.
Thank you, Susie, and thank all of you for watching us today on Health Connections on KCAT Television. I'm Dr. Stuart Menakar from the Palo Alto Medical Foundation, and I appreciate you watching.